Hi everyone, I'm Dr. Gauri Apte, and today we're going to continue our conversation on perinatal mental health. Today we're going to talk about postpartum depression and postpartum anxiety. For that, we have with us Sanhita Sawant. Sanhita is a maternal mental health counselor. Hi Sanhita, welcome.
Hello, Gauri. Hi, everyone.
All right, so Sangeeta, we've all heard about postpartum depression, postpartum anxiety. Why is it that these symptoms and disorders are so common during the postpartum period? Is there an explanation for that?
About women who are suffering from postpartum mood and anxiety disorder,
Mhm.
we need to remember that they are not to blame. Uh, it's a cumulative effect of the risk factors like rapid change in hormone levels, the trauma that body goes through during pregnancy and childbirth,
Right.
genetic risk, other biological or inflammatory processes. We know that social stresses like financial strain, troubled relationships, change in the family structure, pressure to be a perfect mom. So all these risk factors, are the contributing in the overall picture.
Right. And so during the last video, we talked about how PMAD is a spectrum of symptoms and disorders. So can you elaborate a little bit more on exactly what that means for it to be a spectrum?
Right. So the spectrum includes like many disorders like baby blue,
Mhm.
in which the symptoms are mild sadness, fatigue, increased irritability, sensitivity, anxiety, fearfulness,
Right.
and the symptoms no more than 14 days, and they diminish also without any kind of intervention treatment. But if lasts more than 14 days, then it's more than the baby blues. Then there is postpartum depression, in which the severity of symptoms are more than the baby flu.
Mhm.
Then there is postpartum post-traumatic stress disorder, like reliving the traumatic event, nightmares, flashback can be triggered by traumatic childbirth.
Right.
Uh, there is a postpartum OCD, obsessive compulsive disorder, which includes repetitive intrusive thoughts, compulsive behavior. Then the postpartum bipolar disorder, in
Mhm.
which the alternating period of depressed mood and elevated mood.
Right.
Then the much more severe like postpartum psychosis, in which the thoughts of harming baby or harming oneself, seeing images, hearing voices, acting
Right.
paranoid, having suicidal thoughts. So the postpartum psychosis is a true emergency
Right.
situation in which the immediate medical attention is required. So
Mhm.
all these disorders come in the spectrum.
Right. So it really is a range of symptoms and disorders, you know. And as you mentioned, postpartum psychosis is a medical emergency and requires immediate attention. But what about the slightly less severe symptoms? What are some signs that new moms and parents should look out for, and when should they seek help from a professional?
Like if the new mom, if she's not able to function, like depressed mood, markedly diminish interest in daily activities,
Mm.
she doesn't want to see anyone, she's not she doesn't seem to connecting with her baby,
Mhm.
anyone else near a baby, recurrent thoughts of death, suicide.
Right.
uh, we need to watchful about these symptoms,
Mhm.
and please don't wait. The new mom will bring it up, this, because she may not notice this signs in herself,
Mm.
or maybe she feels guilty or ashamed about it.
Right.
uh, the professional help here is very much important, because it will work on all the levels, physical, hormonal, psychological, emotional, social, uh, because and it will uh, help to differentiate also between the mild symptoms and the severe
Right.
symptoms,
Right.
because most of the time the mild symptoms may progress into severe symptoms if
Right.
it is untreated. So it's professional, person will able to provide that non-judgmental listening
Right.
ear, or can help to deal with the issue in more healthy way.
Yeah, yeah, no, absolutely. That makes a lot of sense. And just as a follow up to that, is there a certain time up to when new moms and parents should be watchful? So, for example, if a mom doesn't develop any symptoms, say 3 months postpartum, does that mean she's in the clear, or can she develop symptoms later on?
Yes, the postpartum symptoms can develop anytime after the first year of the childbirth.
Okay.
For an example, the symptoms can appear after maybe when once she'll start going back to her work after maternity leave,
Right,
or maybe not having that extra family support after some time.
right,
uh, all these biological, social, emotional triggers can
okay.
lead to appear the symptoms anytime throughout the first year of childbirth.
Right, right. So, you have to continue being watchful for 1 year postpartum, really. So I
Yes.
think, in a nutshell, basically, there are a whole lot of stressors, both physically and externally, which can cause women to be more susceptible to developing symptoms postpartum. But keeping an eye out for symptoms and seeking early intervention can definitely be helpful.
Yes, true.
All right, thank you so much, Sangeeta. That was super helpful. And to all the new moms and parents out there, you are not alone. PMAD is much more common than we think. So if you don't feel so good, speak up, seek professional help. You are already doing great. And if you have any other questions or comments, you can leave them in the comment section below. You can also email us at info@fertilihealth.com. Thank you, everyone, for watching. As always, stay safe. Thank you, Sangeeta. Thank you.
Yeah. Thanks. Thank you.